It can be like multiple pieces, which isn't nearly as satisfying as just this large piece, hunk that just kind of falls out all of a sudden. And then the camera zooms in and you're like, what bird just pooped in this little receptacle?
100%.
Yeah.
Welcome to the Ask an Audiologist podcast, real audiology white papers written by real audiologists and explained to you by a real audiologist and a guy who isn't. Now here are your hosts, Dr. Ali Tressiter and Kevin Ziener.
It's Monday, and that means it's another episode of Ask an Audiologist. I'm Kevin Ziener.
And I'm Dr. Ali Tressiter.
And for today's topic, we head up to New Jersey to Oracle Hearing in Lawrenceville, New Jersey, as Dr. Yasmin Batat writes about ear irrigation. Say that 3 times fast. Ear irrigation, ear irrigation, ear irrigation.
Actually
Nailed
impressive.
it. Thank you. I really like this topic because it combines both medical and social media. I actually saw Dr. Batat not too long ago, and she has leveraged what we are going to talk about today into a large following online, as have a lot of other people, because she uses an ear irrigator in her practice and then posts the results of that online. So whether you watch ear irrigation videos or you know, you're just kind of inquisitive about what it is that an ear irrigator does, this is the episode for you. So Dr. Ali, I turn to you and I say, get everybody excited about ear irrigation, which is today's topic.
Well, clearly, everybody's already excited about ear irrigation because it involves earwax. And we are all gross and love to watch earwax get removed.
It's true.
I mean, let's just be honest.
It's totally true. I mean, we have talked about that on this podcast before, and I feel as though it only gets better or worse depending on what side of the spectrum you're on.
Both
Yeah,
at the same time.
totally.
For sure. So ear irrigation, it's exactly what it sounds like it is. You put water into the ear and that water helps flush the earwax out.
Again, I'm going to take my very menial knowledge of any of this that I learned on social media. And so is there, like, sometimes you see videos of like what looks like a little pincher go down the ear canal to kind of take the earwax out, and it'll reposition. And clearly there's an audiologist at the other end and there's a camera that they're seeing in real time. Is there a difference between that and an ear irrigator, which uses water, in terms of safety or comfort or accessibility, or are they kind of just 2 different widgets to accomplish the same thing?
That.
Okay.
So it really is up to the audiologist or the professional that's removing the earwax from your ear. And sometimes it has to do with if it's really hard or if it's stuck to the ear canal. There are different reasons for why we would choose different methods, but and I think I said this in one of our podcasts, to whatever your audiologist is most comfortable with, that's the one that you want them to do.
Got it.
But I think what you were talking about was like an alligator forceps.
Yeah, totally.
I find those incredibly satisfying to go in if you've got a chunk of earwax that you know you can get out in one grab and just kind of put them in there and pinch and bring them out.
So then talk to me, like, obviously we typically only see the successful cases, right? Where either a long tube comes out or we see just a bunch of gunk flushed out over time. Like, what is the general safety concern with either an alligator in your ear or some warm fluid in your ear?
Sure. When it comes to actually sticking something hard in the ear, like the alligator forceps, like a curette, there's always an inherent risk that the skin inside your ear canal is incredibly thin and it's very sensitive. Okay. So there is the potential for that to cause some irritation, or sometimes you can draw blood. Doesn't always hurt, but it's just such thin skin. So there is risk there. And of course, if you've got something hard in the ear and all of a sudden you, for whatever reason, turned your head really fast, unless if your professional isn't bracing that curette, you could always poke yourself in the eardrum. So when it comes to ear irrigation, that really, for me, has always been the safest method because I'm not sticking anything hard into the ear.
Sure.
Now, and you had said warm water, and actually we don't want warm water and we don't want cold water. We actually go for a very specific temperature because if you put really cold water in your ear canal or you put really warm water in your ear canal, it's going to make you dizzy.
So like tepid. We're just looking for that room temp water.
Sure. Yeah, around that.
Really? Cold water? I get cold water making me dizzy. For no other reason than I just understand that. Warm water, I just be like, this is like going to the spa. Just shoot some warm water in these ears, baby.
It would be, you'd be at the spa and then want to vomit.
Yeah, I'd fall face first into the jacuzzi.
Yes.
So my other thought, again, anecdotally, would be like the alligator. What do they call alligator forceps?
Yep.
When you pull, would you be worried about pulling any of the hairs in the ear, or like how destructive would you have to get with that?
I mean, you'd have to be going in pretty rough.
Right. Okay.
Usually when if it's a piece, if you're using that device to get it out, you can usually see a place where you can clamp onto it. It's rare that someone has that much hair in their ears, except I will say older gentlemen sometimes can have that much hair in their ears, but in general, you're not going to hurt it too much.
So for people who for some reason haven't seen an ear irrigator, can you just give us an explanation of what it looks like? Because it is a weird contraption. It's bigger than people expect, and it looks like there's a magnifying glass component. It looks like, but continue. You know it far better than I.
Prepare to hear the best thing ever.
Love it.
So you're right. It does have it's almost kind of like a little magnifier, so you can see a little bit into the ear canal, but it's shaped almost kind of like gun shaped. Yeah. So you've got a lever that you'll pull, which will actually put the water into the ear.
And can you control the pressure of the water? Like hard or soft, or is it one fluid stream?
You can control the because you definitely don't want. I've heard of people using water picks in their ear to try to simulate this, and it like makes me cringe because like I've got a water pick and that thing is aggressive.
Yeah, that'll hurt. It hurts my tongue using a water pick. I can't fathom shoving that in my ear.
Not advised. Yeah. So let me just put that out there. Don't do it.
Don't do that.
So you can control the flow, but also that disc that you see also serves to really kind of protect my face so that the water's not blowing back at me. But everybody who's listening to this must go and Google this afterwards because it is so satisfying. So good. The water will just flow into the ear, and it over time it can loosen up the earwax. It can kind of, if it's connected to the wall of the ear canal, it can soften that up, and then a lot of times it'll come out in just one big chunk, and it is awesome.
That's the best. So that's what I'm curious, and I don't even know if you know the science behind it, right? So you're just kind of like, I imagine moving it in some type of circular motion, right, to hopefully get the separation between the earwax and the inner ear canal.
Yeah, and you don't even have to move it, honestly, too much, because just the way the water is going into the ear, it's going to serve to pull it out.
And so then is there any risk with the water? Like the water makes more sense to me. Like I've said, it makes more sense to me from a safety component, dislodging everything. But then is there any risk that we are now going to have too much water like in the ear canal?
No. And
worst case scenario is like a swimming pool thing.
Yeah, like you get a little water stuck in your ear. And in that case, you can put a couple of drops of alcohol, like rubbing alcohol in there, let it sit for 1 to 2 minutes, and then let it drain out.
Got it.
The only time it becomes a concern is if there's a perforation or a hole in the eardrum.
Oh.
So if you have a perforation or a hole in the eardrum, we obviously don't want to be putting water into your ear canal because then you can cause infection and all sorts of things.
And I can't imagine the ear irrigator would cause a hole in the ear canal.
No.
That'd have to be set on like super soaker mode, right?
That's the water pick.
Got it. Yeah, that's the water pick. Exactly. Yeah. So, and then the only other component, which is people like, so what does this just fall out of the ear onto the ground? Is this little kind of shoulder box cup that sits there that everything just kind of falls into. And then that's where you see these little dark flecks of gold, blackish, brownish, yellowish earwax fall into.
Yep.
And it is, like you said, it can be like multiple pieces, which isn't nearly as satisfying as just this. An earthworm would be too much, but large piece, hunk that just kind of falls out all of a sudden. I mean, and then the camera zooms in and you're like, what bird just pooped in this little receptacle?
100%. Yeah. I mean, you're exactly right. And that's why it's really a 2-person job if you've got 2 people. So someone is pushing that reservoir up against your neck, because you don't want like your earwax soup to get all over you.
I did think like if people hadn't seen it and were explaining it, they're like, so do they just do this like in a shower setting? Like does the patient have to remove their top? It's like, no, there's this cup that goes on there. It's form fitting. It's really nice. Whether you're into that or not, I recommend it because How long have ear irrigation tools been around, or that particular thing been around?
That's a
for?
great question that Google could answer.
Yeah, to me, I thought like it feels brand new because if you go on like TikTok or YouTube, there are only so many people who are using it. But those are just, I guess, people who have started filming it as opposed to it being around for like 10 years.
It's definitely newer. It's not, brand new.
Yeah.
But I do think, audiologists who have been in practice for a long, long time are probably very confident and comfortable with curettes or alligator forceps or whatever. And some of the newer audiologists, because they've had the opportunity to be trained in school with the irrigator, that maybe that's just the preference. And so, yeah, I don't think it's that old.
Makes sense to me. So if you want to see these videos, go to YouTube, go to Facebook, go to TikTok. But if you want to hear more audiology related content, visit us at askanaudiologist.com, or you can continue to listen to this wonderful podcast. Dr. Ali, as always, thank you.
Thank you, Kev.
We'll see everyone next week.
You can find more information at askanaudiologist.com, and you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only and does not substitute for professional medical advice.